Very often I'm asked this question that are hair transplants permanent? And if not, what is the life of the hair transplant? So today in this video, from the beginning to the end, just stay here to hear all transparent facts which you may not know about the longevity of hair transplant results. Hi, I'm Dr. Mayank. I'm a board certified plastic surgeon, diplomat of American Board of Hair Restoration Surgery, and founder of Crown. When we talk about the life of a hair transplant, the hair transplants are not something which is going to give you permanent results. Most of the surgeons and clinics try to sell this as permanent solutions of baldness. But as we all know, the donor area of an individual is the side and the back of your scalp, which is what we are extracting and implanting in the balding areas. As we age, after 25 years of age, every decade you lose 5 to 10% of the volume of the donor density as well. So if we are taking these hair and implanting in the balding areas, how do you expect it's going to be permanent? But definitely hair transplants give you long-term results. The longevity of this transplant depends on multiple factors. So let's split this video and talk about all those. When we talk about the first thing, it comes to patient factors. So what exactly is your age? What is the kind of genetic pattern that runs in the family? And what kind of donor do you have? In terms of age, if you are going in for a hair transplant at a very young age, the progression of your hair loss is going to happen over a period of time. So if you're getting your front transplanted, you may lose hair in the mid and the crown over a period of time. The sides may fall down further, the temples may recede as well. So obviously it starts looking unnatural over a period of time when the hair loss progresses. You definitely need to be on medications after the surgery to prevent further losses, but this does not prevent your losses. It's going to just slow down that progression. So if you're getting a hair transplant done at a relatively young age of 24-25, be mentally prepared that in spite of using medicines, you will require additional sessions of hair transplant over a period of time. The second factor which contributes to this is the genetics of yours. So if you have just started receding in terms of your hairline with a Norwood grade 2 to 4, and you feel that someone who has approximately around grade 6 or 7 running in the family, in that case, you may reach that advanced grade of baldness as well. So obviously, as the baldness progresses, the donor area also shrinks. This is something that can hit your results. So if you have advanced grades of balding running in the family, please inform your surgeon, talk in detail about it so that the plan can be done not just for today, but for all the years to come. When we talk about the third thing which contributes to the long-term results, it is your donor area. So the safe donor area of an individual is limited in the side and the back of your scalp. When we talk as we age, the safe donor area, the volume is going to shrink. So if you talk about the techniques, the FUT technique, which is the strip surgery, is something where the strip is taken from the centralmost part of your safe donor area. These are the hard core follicles of your scalp which are going to stay for the longest possible time. So the long-term results with FUT are definitely much longer in my opinion in comparison to FUE. The reason for that is in FUE, we are punching the area from the side and the back of your scalp in a manner that the safe donor area may have thinning from above and below, and as those follicles will go and get engulfed in your grades of baldness, you may have a chance that you will lose further hair follicles from the recipient area as well. That's why the planning of your donor area as per your age and genetics is extremely critical for your surgeon to do. So next we'll talk about the second heading, which is basically the post-op recovery phase after the surgery. When you get a hair transplant done, your care after the surgery is something that is actually going to control what is the long-term results that you're going to have. So if your scalp is not healthy, if you're not taking adequate precautions for the hair follicles which have been implanted in the first few weeks, and also the exact care that has been told to you of not scratching and not itching onto the scalp wherever the follicles are implanted, maintaining the hygiene, seeing to it that there is no infections or acne or dandruff or flakes depositing on your scalp. All these factors, if you're taking care of, you are definitely making it sure that your long-term results will be good. The third criteria which would determine the long-term results of your hair transplant would be actually your lifestyle. So obviously, if you're indulging in activities where you are not taking care of your health, you are smoking, you are dependent on actual alternate substances, or you are vaping, you have nicotine content, or you are inhaling a lot of fumes, then obviously that is something that is going to hit your hair transplant results badly. This all collective aspect will definitely reduce the blood circulation to your scalp and will affect the transplanted hair as well as your native hair. So please don't indulge into smoking or any such activities. Take care of your health. Your life has to be relatively stress-free. Obviously, the daily stress which almost all of us experience is not something I'm talking about, but major amount of stress should not be a part and parcel of your life during the transplant and the post-transplant phase. Indulge in activities which give you happiness, where you feel calm, where you feel peaceful, whether it is meditation, it is yoga, it is working out, it is cycling, or playing any sport that gives you that kind of a high that you feel good about yourself. So these are things which you can take care of in your lifestyle. Another thing which is very critical is your nutrition. So when we talk about the post-surgery phase, take care of your nutrition. Now, what should be the contributory factors to your nutrition? Obviously, your hair is made up of proteins, so your protein intake post-surgery has to be good. You should be having a rich contribution of vitamins and minerals which may be deficient in your diet. So if you're running deficient on those, we can get them evaluated and checked in blood tests and see to it that you're given supplementation in that healing phase and the phase when your hair are going to grow. So any deficiencies of vitamins, specifically vitamin D3, B12 or iron deficiencies, if you're having them, so it's very critical that we maintain the normal levels so that it does not impact your growth. So take care of all these aspects in terms of nutrition as well, and that's going to add on to the life to your hair transplant. The last aspect of what you need to do is basic hair care, what you have to do for your native hair that you have on your scalp. So first of all, use a mild shampoo, which is a paraben sulfate free shampoo meant to be used for a daily wash. This is something that your surgeon is definitely going to give you after the hair transplant. Along with that, if you have issues of dandruff and flaking, you should have the alternates which should be aligned with your surgeon. So obviously they will give you ketoconazole based shampoos or coal tar salicylic acid based shampoos. So all these things are going to take care of that aspect as well. Apart from this, avoid using any chemicals on the scalp, avoid using styling products or trying to get blow drying with hot air done, or practically using smootheners or straighteners or curlers after you get a result of the transplant. Use the medications that are going to be prescribed to you by your surgeon to prevent further progression of your hair loss in the form of minoxidil, finasteride and multivitamins. And obviously, along with all these things, just see to it that you take care of your hair like you would do of your babies. So all these factors, when we are combining together, give you the wholesome results. But in spite of all these facts, the basic fact that remains is that hair transplant results are the longest possible hair that are going to stay on your head. If done well and planned well, you would always have a natural look where no one can identify you undergone a hair transplant. But definitely it is an investment you are making to see to it that you have a head full of hair, for which you will require medications, maybe alternate therapies and treatments like PRP and other things may be supplemented along with it. But you need to be clear that this is not something which is going to be permanent and is going to stay for the rest of your life. I hope this makes things clear for you, and if you have any further doubts, questions, concerns, you can just jot them down in the comment box and we'll try to answer all of them. Please do like this video and share and subscribe this channel. Thank you so much.